Hi there, welcome along. My name is Paul Goff. I'm one of the UK's leading physios. Today I'm going to talk to you all about Achilles tendon problems, or to be more specific, that pain that you've probably got right at the bottom of your leg, just above your ankle joint, and probably that pain that's worse on a morning, has been building for 2 or 3 months, finds you somewhere in the 40 to 50, 60 age group bracket, a person that's very active, likes to be out on your feet, and is right now struggling with this pain that just doesn't seem to want to give up. And that's a typical story of an Achilles tendon problem. So we'll talk about that as we go along. We'll talk about what it is, why is it becoming a problem in your life, not just from the pain point of view, but also from a limited ability to do the things that you want to do, whether it's walking or bike riding or running or swimming or yoga. It affects a lot of things, and we'll look at why that does that. We'll look at how physio can help you, and along the way I'll offer you some tips on things that you can do to immediately help yourself. First, an introduction to me. That's me. My previous career was working with Darlington and Middlesbrough Football Club here in the Northeast, and more specifically I've been over to America to work with people like Paul Scholes at his recent soccer academy. Paul Scholes obviously from Manchester United. So Achilles tendon problems, they're big in sport, but they're also massive in just general population. And like I say, the big sort of category of person that I might see with a Achilles tendon probably is somewhere in the 40 to 50, 60 age group, likes to be active, likes to be out on their feet, does lots of walking, bike riding, hills of Gisborough, wander around Durham, on the flat and the front at Seaton Carew in Hartlepool, places like that. So we'll talk about all of that. But first, I'm going to introduce you to the real problem with Achilles tendon problems. It's this thing called scar tissue. And if you have a quick look on the image, the bit that I've highlighted is exactly where the Achilles tendon problem is. But it can also lead to pain in your calf muscle. Now, what happens with an Achilles tendon problem is these things get damaged. It could be as a result of a trauma. You could have fell, you could have slipped, you could have just overused it too many times. And what happens, your body puts down this scar tissue. Now, the way I would explain scar tissue is to try and think of glue or cement. If you damage something at home, the first thing that you likely do is try and repair it with glue. And glue, because it's really strong and really tight, usually does the job. But the problem with scar tissue is it repairs the muscle, but if it keeps putting down too much of this glue or too much of this cement, this Achilles tendon can become really inflexible, can become less elastic than it needs to be, and it affects your calf muscle. Now think of pulling a rope. If I was to pull a rope at the bottom, it'll tighten at the top, and that's the reason that you get that pain possibly up there as well in the calf muscle area. You can see I've highlighted it on the image in the circle. So the star image is where you'll expect to experience pain in the Achilles, and the circle is where, if that Achilles gets tighter and tighter, is where you'll expect to feel pain in your calf muscle. First, let's confirm, are you actually suffering from this Achilles problem? You'll probably have a sharp pain in the back of your leg. It's particularly worse right at the bottom, just above the line of where your shoe, let's say your trainers, will be touching at the back of your leg. And you'll probably be able to see or feel some kind of lump or bump at the back, just above your ankle. And it's often red, it's often swollen, it's often inflamed, and it's usually very visible. The little trick to do is just obviously compare your left one to your right one. More often than not, one is worse than the other. And you've probably had a gradual onset of pain. This thing just keeps getting worse. Doesn't have to be any form of you had an accident or you had a particular injury. It was just something that all of a sudden one day you felt was getting worse and worse. And like I say, this is a classic injury somewhere in the 40, 50, 60 age group, and on the list of easily the top 5 most common injuries that we'll see in this physiotherapy practice. A quick look to the image on the left, you'll see the white thing. That, believe it or not, is your Achilles tendon that heads up towards your calf muscle. And when I show people that, they're often quite surprised at how long this Achilles tendon is. The reason why it appears white is it's because it's got very limited blood supply, which means it's very difficult to heal on its own. So the things that we do in the physio clinic are all aimed around increasing blood supply and sending blood supply to that Achilles tendon area. Things like hands-on physio, massage and stretching will all send blood supply to that area. And one more thing about the Achilles tendon, it's nearly always worse on a morning, and that's usually the point where that person will come up to us, they'll call us and they'll say, look, I can't deal with this any longer because this is just getting worse. And getting out of bed on the morning can be quite horrendous, can be quite horrific. It's going to be worse on the morning because your blood supply is much less through the night. So if you think about it, you don't need the blood supply in your muscles or your tendons, it just needs to keep your blood supply going to your heart, your brain, your organs. So your foot is pretty inconsequential on the night, but by the time you wake up in the morning and you want to use it, because there's not much blood supply, this Achilles tendon is even worse than it was the day before, and it's the reason it'll often take you 15-20 minutes on a morning to get going. So not uncommon if that's happening to you. So what is an Achilles tendon problem? It can be a tear, or it can be a gradual progression, a gradual breakdown of the muscle fibers or the tendon fibers in that Achilles area, and it attaches all the way up to the gastroc, or part of your leg, which we showed you on the image a little bit earlier. Is it torn or strained? It can be either. Once them fibers in that Achilles tendon start to become torn, or they become strained, they become broken, they become worn, all sorts of things goes on, and this scar tissue basically is put down to repair it, but the scar tissue doesn't have the flexibility, doesn't have the elasticity, if you like, that your original tissue, let's say in your 20s and 30s in your Achilles area, would have had. So we call it an overuse injury because it just gradually pulls on this scar tissue, and you're on this vicious circle that you kind of can't get off. And the best way to think of it is like this. I described to you the reason that you might get pain in the calf. Now think of a rope, but if you think of an elastic band, if you pull an elastic band really tight and you keep pulling it and you keep pulling it, eventually it'll fray. And as it frays, your body will put down this glue or this cement to try and help it to heal, which it does. But if that keeps happening week after week over 1 year, 2 years, 5 years or 10 years, eventually you're going to end up with a really stiff and a really strong and really tight Achilles tendon. And it's the reason that eventually it gets so tight and so stiff that it causes you pain, and literally it's very difficult to shake. It could also look something like that. We've seen it before where the Achilles tendon can be damaged, it can be torn, it can get a little bit of bleeding, very minimal, but if something goes on in and around the Achilles and the calf area where there's too many fibers torn, you can see a little bit of bruising and bleeding coming out. So why are you getting in the pain and the restriction? Fibers are torn. Anything that you tear will cause you pain, and the swelling will make it feel as though it just doesn't want to go anywhere. It's swollen for a reason because it's trying to stop you from being active. So it's your body's own way of trying to protect you, basically. And like we said earlier, this thing often heals wrong. So the more scar tissue that's put down, the tighter it gets, and you're constantly pulling on this elastic band, which doesn't want to move, doesn't want the flexibility, and will cause you pain. Pain, usually inflammation, gets sore for a few days, you ice it, you rest it, you do all the things, the pain settles down, but as soon as you're active again, this Achilles tendon pain comes back. So it can be a bit of a nightmare, to be honest, and like I say, it's the reason. It is very difficult to self-manage because it's almost impossible to stop walking or stop doing the things that have probably caused the thing in the first place, and it is the reason it's on the top 5 list of the most common things we'll see in this physio clinic. So how can physio help? It has to be hands-on. There's no way that you can get away with Achilles tendon pain and problems with just stretching alone. It's got to be hands-on plus exercises. You'll get the relief that you need. So we'll do the deep massage, we'll do the stretches, we'll do the frictions. There's so many things that we can do with these things to try and settle it down. We'll give you an explanation. We'll talk to you. We'll maybe look at your back, see if there's any problems with your back. There's a big link between Achilles problems and back pain, and also between ankle sprains and Achilles problems as well. It may be that your ankle is really stiff, and if we can get your ankle loose, it'll loosen off the pain and the stiffness in the Achilles as well. So we look at both. We look above and below the pain to try and solve your problem. And we'll also give you exercises to do at home. These are vital in conjunction with the hands-on treatment. So think of the hands-on treatment trying to loosen it, trying to realign this scar tissue, these fibers that are going wrong, basically at the bottom of your foot. Introduce that with some exercises, and you're likely to get a faster cure or relief from your problem. We'll also tell you when it's safe to return. Going back to the activities that you love to do, whether it's bike riding or swimming or walking or yoga or even just being pain-free, walking to and from work is one thing, but safely increasing your level of activity is another, so that you know it's not going to come back. So I would advise with this type of injury, it is on our top 5 list. Come in for help as soon as you can. It'll probably take us 3 to 4 weeks, 3 to 4 physio sessions, which will involve deep massage, lots of stretches, and specific exercises that we'll give you to help reduce that pain. We're in Darlington, Durham, Gisborne and Hartlepool. Picture there of our inside of our Hartlepool clinic. We'll be very happy to hear from you. And if it does turn out that this Achilles problem is something that we can't help with, or it wasn't an Achilles problem that you booked in for that you thought you were, we won't charge you for your session. Our physio sessions, we never charge them if we can't help you, and we'll tell you straight away who the best person is to see. If these Achilles problems are so bad, we will tell you that you need to see somebody about the possibility of injections or surgery. But that's rare, but it can happen, and we'll tell you that straight away. To get to us, you need this number, 0800 043 8671. Our reception team, that's Vicky, you can see in the picture. Vicky and the other girls will be very happy to hear from you. And if you want to speak to one of our physios, again, you're more than happy to do that. So just to recap, with Achilles tendon pain, we will give you hands-on treatment. You'll get massage and stretches from us. You'll get an explanation of your injury. We'll look above and below. We'll look at your feet, and we'll look at your back to make sure that there's no problems that are going to keep an ongoing problem or longer-term problems with the Achilles problem that doesn't need to be there. We'll give you exercises to do at home, and we'll tell you exactly when it's safe to return and up your activity levels accordingly to your recovery. So physio can definitely help you with an Achilles tendon problem. Number you need is 0800 043 8671 for us to help you. That's it from me. Thanks for watching. Take care, and I'll speak to you again soon.